In this short video, I have 2 tips for you as we work on chapters 11 and 12 in our textbook. These 2 tips I think will help provide you with a nice framework for integrating all of the information that you're learning in chapter 11 and in chapter 12. So the first tip, as you're working on chapter 11, you'll be learning about threats to validity. And it can get very overwhelming. So we've learned about multiple types of validity and multiple types of reliability in this course already. Chapter 11 focuses on threats to validity in both pre-test, post-test design types of studies and in experimental design types of studies. So if you're starting to feel overwhelmed and like there's just a cloud of validity and threats to validity swarming around your head, here's my advice to you. This will not only help you to understand the information, but it will help you to process the information deeply so that you can remember it more easily for the quizzes and for the final exam. And I will be talking a little bit more about the final exam in the upcoming weeks. We've got a couple more weeks left of course content, and then we'll be focusing on the final exam. So as you're approaching the final exam and you're starting to grapple with all of the different types of validity and threats to validity that we've been learning about in this course, my suggestion is for you to create a chart. I would create the chart for you, except that the act of creating the chart will help you to remember the information, will help you to sort it out in your own mind. So it's actually beneficial for you if you create your own chart. And in your chart, what I recommend is that you have different types of study design in your columns. So maybe one column would be pre-test, post-test design, another column would be experimental design, you might have a column for correlational design, and in your different rows you can have different types of validity and different threats to validity. And in this week, in chapter 11, you'll be learning about different threats to validity. For example, in pre-test, post-test design, we're concerned about maturation effects, history effects, instrumentation effects, we're concerned about attrition. So there are multiple threats to validity just for one particular type of study design. And I recommend that for each row you list a threat to validity with the definition, and then you can place a check mark in your chart according to whether or not that threat to validity is relevant for pre-test, post-test design or for experimental design. That's one example. If you have another idea for a chart or a table that could work more easily for you, then definitely play around with different types of charts that you could create. But when you have a lot of information that is similar but applies in different ways across different types of contexts, a chart can really help you to organize that information. In this case, we have multiple threats to validity. And all of those different threats to validity, they're similar because they're all threats to validity, but there are different types of threats that apply to different types of study designs. So they apply in different contexts. And it can help you to create a column for each context. In this case, a column for each study design and a row for each type of threat, so that you can start keeping track of which threat applies to which column. Now in BBLearn, I've also posted a lot of information and resources for you to help you learn about these different threats to validity in ways that present the information a little bit more differently. It's a little bit more active compared to what you're coming across in your textbook. So this week you have multiple videos. One video specifically focuses on threats to validity in pre-test, post-test design. There's another video that specifically focuses on the placebo effect, which is an effect that's relevant for experimental design in which you're comparing a treatment with a control. It's important to understand the placebo effect in order to understand the type of influence that a treatment condition can have versus a control condition, depending on how participants are thinking about the study and what participants' expectations are for the conditions that they're assigned to. So there's a video on placebo design. There are videos about double-blind study as a way of addressing some of the threats to validity. So I encourage you to watch all of those videos, create a chart, take as many notes as you can, and process that information in an organized way. If you get overwhelmed and confused, of course, you should always feel welcome to call me, to email me. If you call me, remember to leave a voicemail message because it gets transcribed automatically and sent to my email. You can also schedule a phone meeting with me and we could have a one-on-one tutorial. So that's my tip for dealing with chapter 11. In chapter 12, you'll be learning about factorial design. Again, I've posted multiple resources for you to think about factorial design in different ways. Factorial design means that you are conducting an experiment with more than one independent variable. So 2 or more independent variables. And it's factorial in the sense that there are multiple factors that you're considering. It can be very difficult to think about factorial design. And in particular, it can be very difficult and it can sometimes feel very confusing as you're learning how to think about an interaction effect. So this is tip number 2 in this short video. Tip number 2, as you're learning about factorial design and how to interpret and describe interaction effects, my tip is have patience with yourself. Be okay with feeling confused. These concepts are some of the most difficult concepts to understand, especially as part of an undergraduate degree program. It can often take multiple courses in research methods and statistics, and in many cases, multiple years of higher education to start feeling really comfortable and confident about interaction effects. So have compassion for yourself. And if it feels confusing, that's okay. That means you're normal. That means that you're working through it. So this is one of those situations where the process of learning can be slow, but you will gain understanding. And even after you've studied your textbook and reviewed all of the different videos that I've posted, you still might feel confused. And again, that's okay, that's normal. This is a long-term process of gaining understanding and familiarity with interaction effects.